This video will discuss in greater detail preparation for colonoscopy, blood thinners, and complications. Before colonoscopy, a low-fiber diet for at least 2 days is recommended. A low-fiber diet means no vegetables or fruits, nuts, seeds, or high-fiber cereals. This slide shows you the low-fiber foods that are recommended and also the foods that should be avoided. Low-fiber food includes porridge, white bread, steamed buns, white noodles, clear fish, chicken or vegetable soups, egg, steamed fish, chiffon cake, tofu. So these are some of the low-fiber foods. This slide shows what happens one day before the colonoscope. The low fiber can be continued for breakfast and lunch. However, the low fiber diet must be stopped by 1 p.m. After 1 p.m., only clear fluids can be taken. Some doctors prefer to use Picoselex, which is a laxative. The first dose of Picoselex is given at 5 p.m. and 500 ml of clear fluids should be taken every 30 minutes. Repeat it 4 times, which means that 2000 ml or 2 liters of clear fluids will have to be taken. The second dose of Picoselex is taken at 4 a.m. and similarly 500 ml of clear fluids should be taken every 30 minutes and repeated 4 times. Another laxative that's commonly used is PEG. An example is Fortrans. 2 sachets of PEG is to be taken from 6 p.m. Each sachet is to be mixed with 1 liter of water and sipped 250 ml every 10 to 15 minutes. This means that 1 sachet of PEG with 1 liter has to be completed in 1 hour. So 2 sachets means it has to be 2 liters to be completed in 2 hours. Another 2 more sachets of PEG is to be taken starting at 4 a.m. and in the similar fashion. Recommended clear fluids and sweets and jelly include 100 plus Gatorade, lemonade, coconut water, tea, black coffee, clear soup, apple juice, soda water, preferably without a gas, a little bit of honey, gummy bears, popsicles without milk or cream, hard candies, and plain jelly. Let's now discuss blood thinning drugs. Low-risk procedures includes gastroscopy and colonoscopy with simple biopsies. It appears to be relatively safe if aspirin and other antiplatelet drugs like clopidogrel are continued. However, these medications have to be stopped for high-risk procedures as there is a high risk of bleeding. High-risk procedures include the removal of polyps larger than 1 centimeter. The table shows the number of days before the scope that the blood thinners have to be stopped. This very much depends on the type of procedure, namely whether it's low or high risk for bleeding. The risk of stopping the blood thinners has to be weighed against the risk of blood clots and consequent danger of stroke or heart attack. Always consult the doctor before stopping the blood thinner. This table is a guide as to when to restart the blood thinner after the scope. This again depends on whether there is a low or high risk of bleeding after the procedure. High risk of bleeding would include removal of polyps more than 1 centimeter. The doctor will advise when to restart the blood thinner drugs. Always consult the doctor before restarting the blood thinner. because if it is restarted too early, there is a high risk of bleeding from the site of the polyp removal. Let's now look in greater detail at the risks of gastroscopy. Sore throat is common. Nausea due to the effect of the sedation. The effects of the sedation can sometimes last for a day. Now, there are more serious complications, and one should consult a doctor immediately if these symptoms are experienced. Severe abdominal pain and bloating of stomach with a hard abdomen, which is suggestive of a tear in the lining of the digestive tract, and it's a very serious complication. Fortunately, it's very rare. Vomiting or blood, or having noticed black stools due to bleeding, and this may happen after removal of a polyp. Severe redness and swelling at the site of the intravenous line. Severe sore throat. Cough and pneumonia due to stomach contents entering the lungs. Fever. Anyone having these symptoms should consult their doctor immediately. Let's now look at the risks of colonoscopy. Bloating of abdomen with cramps is common and is relieved by passing gas. Nausea due to the effect of the sedation. Some blood in the stools for a day or two due to removal of a polyp. The effects of sedation can sometimes last for a day. Let's now look at the most serious complications, and one should consult a doctor immediately. Severe abdominal pain and bloating of stomach with a hard abdomen, which is suggestive of a hole in the bowel or colon, causing leakage of bowel contents into the abdomen, and is a very serious complication. This complication occurs in about 1 in 1,000 colonoscopies and is commoner after removal of a polyp. The hole is usually repaired by surgery. Passage of a lot of red blood in the stools due to bleeding and may happen after removal of a polyp. About 1 person in every 100 will experience a significant bleed from the bowel or colon when a polyp is removed. Further colonoscopy, a blood transfusion or an operation may be necessary. Severe redness and swelling at the site of the intravenous line. And finally, fever. Thank you.